When it comes to pharmacies and prescription services, CARiNG Pharmacy is nothing short of a household name. Established in 1994 in Taman Muda, Cheras by 5 passionate pharmacists, CARiNG Pharmacy has since seen a plethora of changes across its almost 3-decade-strong presence. Let's have a look at CARiNG Pharmacy's evolution throughout the years. CARiNG Pharmacy was established with a simple thought in mind: to help the community. Therefore, it started out by offering full-time pharmacy services 12 hours a day, 7 days a week, to enable the community to easily access basic health services. These services included health consultation, free blood pressure check, and other health checks. Fast forward to 2013, CARiNG Pharmacy started to notice that a large number of its regular customers were on long-term medication. This prompted CARiNG Pharmacy to further strengthen collaborations with other healthcare providers to ensure that customers with chronic illnesses could be directed to receive proper medical care and follow-up sessions with specialist doctors. This service was known as the CARiNG Customer Care Program, or simply 3C. In the early days, customers who regularly visited CARiNG Pharmacy for their health checks only had their records kept manually at the particular CARiNG Pharmacy they frequented. As a result, whenever customers had to relocate or were simply travelling in another area, they had no way of accessing their medical records. Thankfully, as the digital era continued to bloom, CARiNG Pharmacy quickly sought the opportunity to expand its electronic patient medication record (PMR) services, enabling customers to keep track and monitor their own health data on the go. Via this service, CARiNG pharmacists across the country will also be able to view the customer's medical records with consent to ensure safe dispensing of medicines. Additional services such as chronic disease management (CDM), medication user review (MUR), and monitored dosage system (MDS) could also be provided whenever applicable. In recent years, CARiNG Pharmacy's PMR services underwent an upgrade and was relaunched as My Health Record, which is a module accessible via the CARiNG app. Via My Health Record, customers can enjoy a wide range of useful functions, which include securely recording, storing, and sharing their health records and medication information with healthcare professionals, monitoring their loved ones and their own health records, setting alarms to take their medications on time, receiving reminders to pick up their medications, keeping track of their allergens, and more. Ensuring customers' convenience and continuity of care is CARiNG Pharmacy's utmost priority. Therefore, in 2022, CARiNG Pharmacy launched yet another healthcare solution for its customers called Cari Doctor. Cari Doctor is an initiative which enables customers with selected health conditions to consult partner doctors virtually at CARiNG Pharmacies and get proper treatment right on the spot. This provides a seamless experience for customers and ensures that their health checks are thoroughly followed through. CARiNG Pharmacy understands that all customers have different health conditions and requirements, and thus a personalized approach is the most effective way to help them. That is why, over the years, CARiNG Pharmacy has continually introduced different specialized pharmacy services to cater to the varied needs of the community. These services include Jom Kurang Manis, a diabetes counseling service, Eat Well Stay Fit, a weight management service, asthma counseling service, smoking cessation service, amongst many others. Besides that, CARiNG Pharmacy is also always actively launching various health awareness campaigns in collaboration with other medical centers and stakeholders, such as the Do It Right Safe Medicine Disposal campaign, health talks, webinars, social media engagement campaigns, and more. Another meaningful initiative by CARiNG Pharmacy is its engagement program with future pharmacists. This program aims to provide pharmacy students with a learning platform and structured trainings focused on pharmacy services. Through this program, pharmacy students will be able to gain valuable insights into the pharmaceutical field and be better equipped when they enter the industry as professionals. In essence, CARiNG Pharmacy has never stopped evolving since its first day of establishment. From its humble beginnings of providing basic pharmacy services to the community, to then providing specialized pharmacy services, to launching various health awareness campaigns, as well as training programs for future pharmacists, it is clear that CARiNG Pharmacy has never once wavered from its befitting motto: caring is our profession.
Hi everyone, good evening to everyone today. Thank you so much for joining our live stream tonight. So first of all, let me introduce myself. My name is Shun Ern, your CARiNG Pharmacist and the host for tonight's live show and live show. Right? So how have you all been doing lately? I hope all of you are fine, healthy so far. Good. So again, thank you for joining us tonight and let us learn something from today's live stream. Right? And today, in this live stream, we will be talking about something that is commonly affect our age population and sometimes even our younger generation as well, the osteoarthritis. And this can be a painful situation, painful problem to any places of any of our joint, especially to our knee. So if you know someone who is suffering this kind of condition, or you yourself are curious about this kind of condition, please share this live stream to your friends and family and stay tuned until the end of this live stream because we will be having an expert in the house who will be sharing with us his professional knowledge about osteoarthritis. All right, and beside that, we will be also having some exciting giveaways to our audience at the end of this live stream. All right, so again, let me share a bit about the background of our expert in the house today. He is a consultant trauma and orthopedic surgeon at ALTY Orthopedic Hospital, who has extensive experience in knee scopes, foot and ankle surgery, total hip replacement, and ACL surgery, just to name a few. Right? So, without further ado, let us welcome our guest of the day, Dr. Mark Chong. Hi, Dr. Mark Chong.
Hi, thanks for the
Good evening.
introduction.
Yep. It's our pleasure having you here. How are you doing lately?
Thanks, feeling good.
Yeah.
Very happy to be here to share with you.
All right.
Yeah.
So thank you so much for Dr. Mark Chong to be present here today to share with our audiences about the osteoarthritis later on. Yeah. So our topic of today is, as I said just now, is something increasingly common and prevalent about among our population, especially to the elderly. And sometimes in my practice, sometimes I can see some younger generation also have this kind of problem. So, doctor, can you give some brief introduction and some of your professional opinions on it?
Yeah, so again, thanks for the introduction. I'm Dr. Mark Chong, a consultant in ALTY Hospital, which is basically a single specialist hospital. and we deal with musculoskeletal problems. So one of the main conditions that comes to the door is osteoarthritis, as you guess it. It affects everyone, not just the old generation, younger generation as well. But some get it quicker than others, earlier than others. But nonetheless, it's quite a challenging problem because as we age, as we live longer, obviously our joint will fail us first. We're here to hopefully educate the audience on how to manage this common yet difficult condition to deal with sometimes.
So yeah, that's of course our aim for today live show to educate our public and our audiences. So just now Dr. Mark Chong mentioned about if something happens to a younger generation as well. Right? So in our mind usually we talk osteoarthritis is usually among elderly.
Correct.
So can see younger generation getting more problem as well.
Yes. I don't know. You want me to share the slides? I prepared some slides there.
So
maybe we can go through it.
Great. So thank you, Dr. Mark, about the brief introduction. So before we really dive into the topic, so if you have any question about osteoarthritis, please put it in the comment section below, and we will answer your question after the slides and the education from the doctor. All right. So also stay tuned for the giveaway at the end of this live stream and share this live stream to your friends and family. All right. So Doctor, so far also for today the topic osteoarthritis of the knee. So what is actually about and how common is it nowadays?
Like I said, it's one of the most common musculoskeletal conditions that came through. I mean, people have been suffering for this for years. It's just that awareness has increased because of social media, education, internet. But this condition has been with us for centuries. But obviously, with the technology, medicine, the things have advanced a bit. Unfortunately, we live better than our older generations.
Yes.
Therefore, I'm very keen to talk about how we can get ourselves to a better level than our previous generation.
Yeah. So.
Yeah.
Okay. All right. So.
Should we start the slide?
Start the slide to
I'll give
give some brief introduction to our audiences.
So as you can see in this slide here, this is a cartoon version of what osteoarthritis looks like if it affects your knee joint. So basically, osteoarthritis is where you tear the knee. So you can see the cartilage is worn out and turns thinner, and the red is supposed to signify inflammation in the joint. So that's where patients get pain of osteoarthritis because of the inflammation in the joint. So, as I mentioned, osteoarthritis of the knee happens when the cartilage breaks down. Why did it break down? Is multiple factors, usually due to wear and tear. And there's also other factors as well, like if you get an infection or you get trauma, the knee, previous accidents. Some people have genetic conditions that predispose them to osteoarthritis at an early age. But what generally happens is osteoarthritis is a condition of the joint that is an end-stage thing. When you have osteoarthritis, when it starts, you can't reverse the process anymore. So it's basically a process where friction between the knee reduces as the cartilage thins out. And as a result, you get inflammation, swelling, stiffness. When I say that the process once started, it cannot be reversed because this is wear and tear, mechanical problem. It's like a tire. Once you start moving, you cannot go higher again.
Change it.
Eventually change the tire at some point. But that is not to say that we can't manage it. Right?
Yes.
This condition, although there's no cure, there are treatments to relieve the symptoms and pain. So we will hopefully talk about some of the options that you may have depending on what level of pain that the patient is in. So surgery is one of the options. Non-surgery treatment is also another form.
We'll go into details later.
Alright, great. Okay. So let's see the next slide.
Yeah.
Move the arrow. So how common it is? Well, I think, like I said before, I think it's quite repetitive, but it's quite common. It's the most common disability in the Asian population, but it's more so in developed country or middle developing countries, because as we grow older with age, we live longer than our older generation. So therefore, our joints fail before anything else. Some of the risk factors as well, such as diabetes, obesity, also increases the risk of osteoarthritis.
So we have to take care of our health.
Yeah.
Although it seems like doesn't really, related to our knee,
Yes.
our joint, but it does affect.
Yeah.
Right?
So when you have chronic condition like diabetes or obesity, you tend not to go out too often.
Yeah.
So therefore, you don't exercise, you still gain weight, your knee becomes stiff, so you got more load to your knee, therefore your knee goes
So that's right.
Yeah.
So doctor, thank you so much for the brief introduction. And usually, who is affected mostly by osteoarthritis?
Yeah. So like I said in the slide, women are more likely than men to develop osteoarthritis in the knee.
Interesting.
Yeah, and most of them develop. The general consensus is starts usually at the age of 40. Yeah, surprisingly, right? You thought it's something that would be happening when you're 60 or 70.
Yeah.
Yeah, but what I mean by when it starts is that the first sign of osteoarthritis can be detected at the age of 40. It doesn't mean that you have symptoms at 40.
Okay.
But you may have symptoms when you reach, 50, 60, you don't look after the joint. Okay. So that's the common prevalence. Yeah. Women usually 40 plus.
Okay.
Yeah.
So women, gender will be one of the factors.
Yeah.
As well.
Correct.
Yeah. Alright. So how does this kind of osteoarthritis affect our body?
Okay. So arthritis can affect any joint, not just the knee joint.
Yes.
Actually, any joint that has this tissue called synovial tissue.
Yeah. Okay.
Any joint in your body that has a synovial tissue can be affected by osteoarthritis. But the most common one is in the knee.
Yeah.
When you get arthritis in the back, affects your spine, your shoulder, your hip, your foot, anywhere that has
any joint.
Yeah, basically. How does it affect? Well, pain, swelling, stiffness, and over time, if you don't look after it, the joint will be destroyed, and therefore the biomechanics of the limb will start to alter, and you will start to see the knee instead of straight knee. People will start having bent knee, and it's quite common if you look back some of the old videos of Malaysia or Singapore in the 60s or 70s. There are a lot of people walking with bow-legged knees around the street.
Yes.
That's basically one of the consequences of neglecting arthritis.
When you walk like that, it seems
Yeah.
like very painful for them.
Correct.
Yeah.
Correct.
So, and usually this kind of condition, what are the causes? What are the common causes?
Like I mentioned before in the past, overweight, obesity is one of the main factors.
Yeah.
Because as you know, heavier you are, the more load you put on the joints. The common ones for younger people to get arthritis is those that had previous knee injury, serious knee injury. And by that I mean if you had a road traffic accident, fallen off a motorbike or a bicycle, and then you neglected your knees, you have ligament injuries that you didn't seek any treatment, all that will alter the biomechanics of the knee, and that will accelerate the progression of arthritis. Some people say, hey, what about running, when a popular sport, cycling, if I do too much of it, can it affect the knee? Well, in theory, yes, but I don't think there's any studies that link to that. I'm not here to say don't run and don't, because you always need to look after your health. So, for the slight trade-off, I think exercise is still very important. I don't think exercise should be related to arthritis.
Some people will say, oh, I'm not joking because I'm scared of knee pain.
Exactly, yeah. So you got to look after your heart.
Yeah.
Without the heart, you can't live. Without the knee, you can still go. Yeah. So like I said, genetics as well is very important. Some people have predisposition to early arthritis. There are certain type of arthritis that are also genetically linked, and these are like rheumatoid arthritis, psoriatic arthritis. These are different kind of rarer cause of arthritis that is predetermined, so you can't run away from it. If you have that bad genes, you get it. That's life. But fortunately, those are yeah. So, and then the last one on the slide, I said crooked bones or joint. So if you have some sort of malalignment or deformity in your limb, your mechanics are a bit off, and that will accelerate the progress of arthritis as well. So that really could people ask me, what is malalignment mean? You know, some people are born with bow-legged. That's a disease that causes people to have bow legs. Sometimes they can have vitamin D deficiency, it can cause you to have bow legs as well, if it's severe. And some people are born with unequal leg length, you know, for example, some genetic condition, and that itself could lead to arthritis because they have a slightly unusual biomechanics compared to the person with symmetrical leg.
Great. Thank you so much for sharing from the doctor. So let's doctor to rest for a while, and it's time for our audience to prepare your finger to answer some question for our giveaway. All right. So this is our first giveaway section. All right. So it will worth CARiNG cash voucher worth 50 ringgit. All right. So listen to the question properly. All right. Great. So osteoarthritis of the knee happens when your cartilage in your knee joint breaks down. Is it true or not? So A is yes and B is no. Just type yes or no under the comment section below, and make sure that you share the CARiNG Pharmacy Facebook page and this live stream to 3 of your friends and family. Right? Tag their name and answer in the comment section below, and stand a chance to win of CARiNG cash voucher worth 50 ringgit. All right, start typing. All right. So, doctor, let's while our audience is answering the question, let's continue our discussion just now. So, doctor, just now we have mentioned about some brief introduction of osteoarthritis and also how it happens and the causes. All right. So, after, let's say, really we worry about getting osteoarthritis, what are the symptoms we have to take note?
Okay, so usually the first symptom that you get is swelling, mild ache in the knee. Usually that's the first presentation. It's not constant, it comes and goes. So sometimes you get good days, sometimes you get bad days. But it's usually associated with stiffness in the morning. Usually in the morning, because the reason for that is because you've been sleeping all night for 6 or 8 hours, it's not moving the joint, so the knee will actually become stiff anyway. But if you have arthritis, that will make it worse.
Yes.
Right? So people will say, oh, I get very difficult to get up.
Very difficult to bend.
Very difficult to bend and straighten. And it takes a while for them to get the hang of it before the pain subsides, before they start moving. So that's the common sign. Sometimes they find that the knee can feel wobbly. What that means is they don't have the control of the knee. Sometimes they just give way. And that's not because suddenly the nerve is gone. It's mainly because of the muscle that's been deconditioned. So if you have arthritis, it doesn't just affect the joint. It also affects the muscle around the knee joint. All right, they're trying to be protective, you know, but at the same time, because they're not using that much, they become disused. Meaning the muscle is not working the same way that it used to be, becoming weak, and not being able to support the weight of the body. So when you walk and you want to turn around suddenly, the muscle is not quick enough to fire, and therefore you feel as if you want to give way. So that's one of the other symptoms. Other symptoms, like you can sometimes hear crackling noises, grinding noises in the knee joint, and that's because when you have no cartilage, you're only exposed with bone. So when hard surface is rubbing against other hard surfaces, you can notice it.
There's also a lot of my customers who came into my pharmacy and complain, when I walk, I have big neck sound.
Yes, correct. That's exactly what it is, basically.
Alright. So there is some symptoms that we have to
Correct. Correct. And then lastly, I mentioned there as well that your knee may sometimes lock. And what I mean by that is you have a little bit of thing called osteoarthritis in arthritis. Basically, osteoarthritis is like an extra piece of bone that grows out of the joint.
Oh, okay.
And that's the reaction. That's basically a consequence of the malalignment in the knee. It's a natural body reaction. Sometimes it's osteoarthritis from the
Okay.
from the knee joint and travels around the knee joint itself. So they move around like cracks.
Okay.
They can get trapped into the knee joint and causes the knee to lock. So the
Like
patient,
stuck.
yeah, they get stuck.
Okay.
Or inability to straighten the leg or bend the leg. They have to sort of wiggle before they can move that thing away, before they can produce the motion.
Like shake the thing away.
Yeah, exactly. So can you imagine how uncomfortable it is?
Yes.
So the patient may complain of locking in the knee. Yeah.
All right. So, so since we know how what are the symptoms to get wrong,
Yeah.
all right. So, how do you usually professionally diagnose of the osteoarthritis issue?
Okay. Well, first and foremost, the most common way to diagnose arthritis is the patient sometimes know that they have arthritis because they read so much with them.
Yeah.
Yeah, they come in and say, "Hey, I think I have arthritis, doctor." I say, "Wow, why? Why? So you don't need me anymore. You know, you can read that." But I think because the internet and the good forum like this is great, then it saves my job.
Save your job.
Yeah, your time. But the common way of diagnosing is actually talking to the patient, listening to their symptoms, listening to their how they affect their daily activity, and then followed by consultation and examination. Usually, this will take about 10 to 15 minutes, and then your specialist may or may not order X-ray test. Usually start out with X-ray of the affected joint, and then proceed to an MRI if necessary. So usually by a combination of consultation, having a chat with the patient, examination, and X-rays, you'll be able to arrive at diagnosis quite easily.
Okay. So, if let's say after you diagnose it, so what are the possible treatment to our patient?
Okay.
So that they are not so scared about the news.
Yeah.
When he's diagnosed with osteoarthritis.
Right. Luckily, I'm in this line where I'm not involved in the life and death threatening situation.
Yeah.
Right? We're talking about a chronic condition. So getting the diagnosis is actually quite easy. But like I said earlier in my talk earlier, managing this is a bit complicated because there are so many options, and the options are there because they're there to help the patient along the journey on how to manage his condition from now moderate to severe. So that's generally how we tailor the management towards the patient's presentation. So obviously the first thing to do is we try to manage this with the patient with the least risky thing. Things like losing weight. Okay, we mentioned all the risk factors.
Yes.
Losing weight, managing your diabetes well, live a healthy life,
Exercise,
jogging, do cycling, whatever that makes you happy and lose weight.
Yeah.
So that's easy way of eating. Doesn't cost much money.
It's easy way, but difficult for a patient to change.
Exactly. So people usually skip that part. And that's why they come and see people like me and you. So the next step from there is medication. Right? So medication consists of pharmacological medication or non-pharmacological medication.
Okay.
So the pharmacological medications are what we term as painkillers. Analgesia, common painkillers. So usually we start out with simple one like Panadol, Brufen, and all sorts of different type of analgesia. And if they don't like the analgesia, you can always look for alternative form of analgesia, so-called supplements, things like glucosamine and collagen and things like that. Okay. So I'm not here to recommend anything. I'm just giving you a broad overview because there's 1,000 products.
There's a lot of products in the market.
So I and I really find it difficult to choose and recommend as well. I think the best advice is try it. Try something, and if you like it, talk to the pharmacist. If you have minimal side effects, then carry on using it.
Yeah. But definitely the maintaining weight and healthy lifestyle.
Oh yeah,
will be the best.
Yeah, for sure.
Most important.
So medicine alone cannot help you. You have to help yourself as well.
Yes. So, other than the medication and also the pharmacology and non-pharmacology, is if let's say really it doesn't help the patient, what's the next step?
Okay, so then you move on. So once they've tried it, make sure that the patient tries it first. Yeah, they can come back and say, hey, doctor, I tried it. And then you ask them, what have you tried? Oh, I only done one exercise. And that's not trying. So you ask them to go back and come back again.
Yeah.
So assuming that they've done all that, try it, and it doesn't work, then the next step is to try and supplement it with injection. Okay. So some doctors will recommend injecting using steroids, using stuff like hyaluronic acid, which is basically a product that is synthetically made to replicate the tissue that produces the fluid tissue that produces the
Yeah.
So the idea is that you give them, hopefully that will lubricate the joint and prevent it from wearing out.
I heard that the hyaluronic acid, the injection is quite huge.
The
needle.
Yes. But no pain, no gain.
So it's quite scary for people who are scared of needles like me.
Yeah, if you're afraid of needles, then you have a problem.
So start with maintaining weight first.
Yes, correct. But then nowadays, with people so familiar with jabs, since the pandemic, we're so used to it. Nowadays, trying injections is no problem. So,
is there any other one?
So there are other forms of treatment as well called physiotherapy. Okay, physiotherapy, as you know, is a controlled way of exercising the joint, the affected joint. So for knee, the physios will work with the knee muscles. So things like the quads, your hamstring, your buttock muscle, and your core. Okay, not just the knee muscles. Because they're all interconnected.
Yes.
Yeah, the knee is connected to the hip is connected to the back.
Yes. So
the physio will teach how to activate those muscles and optimize them so that you can get the best alignment on it. So a lot of people don't believe in physio. Okay?
Yeah.
They say, hey, why not? Is my knee problem? Why am I doing my exercise in my buttocks and my spine? Then you have to explain to them that they're all connected. They're treating it holistically.
Yes.
That's how
they always thought that knee I have to test.
Knee. Correct.
Yeah. So if let's say physiotherapy also is still painful, or is total knee, cartilage going up, is there any surgical treatment?
Yeah, so when you reach to the point where you've tried all these non-operative treatments and none of them work, that is the time when you're going to see. And that's when we talk about surgical treatment.
Yeah.
So surgical treatment done by specialists in a specialist hospital. It usually comprises of two main categories. One is we try and delay the process of arthritis for 5 years' time. Then the other one is we accept that the arthritis is already there, cannot be reversed anymore, we just change the whole part. Okay, so you've got the first part, which is we try and delay the necessity for a joint replacement, which is right beginning. Right?
Which is the last result.
Which is the last result. Yeah. So imagine it's like when you drive with a ball tire. This tire is analogy because it's wear. Right? So you have a tire that's a little bit of wear, a little bit of puncture, you can always clear it up or patch it up.
Yeah.
Right? Yes. So exactly what we do in the knee as well. We can patch things up, we can fill things up.
Yes.
But that has a limited lifespan. Yeah. But as you drive, those holes get bigger and bigger and bigger. Yeah. Come to a point where you bring your comic and say, hey, I'm glad you've been here for 3 years now.
Keep patching.
I can't keep touching you, Yeah. Change the whole damn years. And that's what we do. They will do everything with this.
Thank you, doctor, for that. So
yeah, next slide. Okay, so
so there is some On the slides, Dr. mentioned about self-care methods. So, do you mind to share more to the audiences?
Yeah, so this is what you can do if you have arthritis at home, right? Not many people can make their way to the hospital or the pharmacist because they don't have time or they think it's not serious. So what you can do is you try and self-medicate and do some self-care. So these are the simple advice that we introduce. We take ice or heat to reduce the pain and swelling. That's quite common. We use that in a lot of sports. Injuries as well. It works. I mentioned before losing weight and doing a healthy lifestyle and then take away the stress that we do. Recommend things like swimming, biking, walking up and down, keep your joint flexible. Yoga, Pilates is very common now. That's quite good as well. The other thing is using knee brace and shock absorbing stuff. You can see that around the pharmacy.
Yeah, a lot.
It's good treatment, but I find the compliance to that is very poor.
It's very poor. A lot of people say it's very troublesome.
Yeah, in a hot weather, humid country like Malaysia, Singapore, I think you can only wear it for 7 minutes before you find you're too hot or it's hot.
Yeah.
So it's not as effective in topics. Compared to say days or weeks.
But it does do some.
It does help you
It does help, right?
to relieve the pain for sure. And finally, participate in self-management programs. So these are like self-help groups. If you talk about it, then educate yourself. You have to find that you have better control the condition.
Yeah.
So that's another recommendation to try.
Okay, great. So, Doctor, the first one you mentioned about applying ice or heat.
Yeah.
I get a lot of questions from my patient, my patient and the customer. When do we use ice and the hot one?
Oh, okay. That's actually there's no science behind it.
Okay.
I think whichever that works.
Okay, great. Whichever they feel comfortable.
Yeah, correct. Correct. But be aware that if you apply something, don't apply for too long.
Yeah. Full to the skin.
Because we have to keep people going.
Alright, great. So as Doctor mentioned just now, change in lifestyle is the first thing that we should do.
Yeah.
Right. So
right.
Maybe Doctor can go into details about this.
Yeah. So like I said, we've said it so many times, right?
You say it many times.
Eat, exercise, take enough rest, good sleep, try recreational sports, and all these actually have multiple beneficial effects.
Yeah.
Not just for the knee, but also to the overall health.
Right.
Exactly. So I would always encourage people to try and get up, join a dance group, join a sports group. Doesn't matter whether you're a beginner or intermediate level. Because not many people are beginners.
Yeah,
right?
definitely.
Only 1% of them.
Just move.
Yeah, exactly. Just move your body, and your joints are meant to be used. That's what it's for.
Yes.
If you don't use it, they will punish you.
Yeah.
They will become painful instead.
Okay. But a lot of my patients actually asking me as well. They already have osteoarthritis problem. They have already suffering pain. So how they want to go and do exercise like involve joint?
Yeah. So like all things, you can always modify your activities according to your level of fitness, right?
Yeah.
So as a Olympus, you do 10,000 kilometers.
Yeah.
All right. Okay. If your average person, you do 5 kilometers. That would be good. But if you have someone with pain in the knee, you can reduce it or modify it. For example, if you think that running causes a lot of pain, you can switch that to cycling or swimming.
Okay.
Yeah, still gives you cardiovascular.
As long as you move it.
As long as you move the joint, it still does its work.
Alright, great.
Yeah. So I think having pain in the knee is not an excuse not to do it.
There's no more excuse for them not to do exercise anymore.
I think so, yeah. There's so many equipment nowadays you see in commercial gyms, right?
Yes.
You just sit down, read your iPad or book, and you just
Yeah, exactly.
Yeah, even that is good.
Yeah. Alright, great. You just move your joint. So people move your joint even if you have joint pain, right? They can help you. So actually, now we have come almost to the end, I think. So and now it's time for our second giveaway session. Alright, so and this giveaway will be from ALTY Orthopaedic Hospital. So they will provide you with a bone health screening voucher worth 399 ringgit. Right? So it's very exciting. So make sure that you answer correctly and share to your friends and family. Like Facebook page, share this live show to your friends, 3 friends and family. Alright. So the question is, who is more likely to be affected by osteoarthritis? It's either women, people aged 40 and above, people with previous injury, or all of the above. So answer in the comment section below. Again, like the CARiNG Facebook page and tag 3 of your friends and family to stand a chance to win the ALTY Orthopedic Hospital Bone Health Screening, which worth 399 ringgit. Alright? And other than answering the question, and you can keep putting your question at the comment section below, and I will get Doctor to answer your question in short while. Alright? So, Doctor, so we have some questions coming in. Okay, so yeah, so for the first question from Ida. So is gut also one of the factors of osteoarthritis?
Yeah, good question. So yeah, gut is one of those what I call a genetic predisposition to arthritis. Mm-hmm. Some people have conditions that makes them sometimes go to gout, and if they left untreated or not controlled well, that can actually cause problems with joint.
Okay. Yeah.
So there is this condition called gouty arthritis,
yes,
which can be. So the management is pretty much the same in all forms of arthritis, except that you might have to take extra medication.
For gouty arthritis, they also have to take care of some certain foods, right?
Yes.
Yeah.
Correct.
Okay. So yeah, yes, gout is one of the arthritis can cause is one of the factors that can cause arthritis issue, can cause a joint pain issue. All right. So second question, so from Judy, does taking glucosamine helps in preventing early occurrence of osteoarthritis? I just mentioned, Doctor mentioned about some non-pharmacological way.
Yeah.
Is glucosamine really?
So like I said in the talk earlier, these supplements are meant to supplement or help you to control the condition, but it doesn't actually cure it. Okay? Because there's no cure for arthritis. Right? So what we're trying to do here is try and delay the progression. Okay. And it does show that some of these supplements does help to prevent or at least slow down the progression of the arthritis.
So some of these supplements can patch the tires
a
little bit more longer. Correct. All right. Okay.
But to what extent, nobody knows because there's lack of studies out there to say which is better than the other.
Yeah. But there is some studies which shows it can help, right?
Correct.
There's no comparison.
Correct.
All right. So again from Judy, another question from Judy. Will wearing high heels can cause one of the issue will wearing high heels for a longer period of time cause arthritis?
Oh, you're going to look beautiful. I don't think so. I think, obviously if you wear high heels 24/7, it will cause you back pain.
Okay.
But I don't think there's any studies that think high heels will osteoarthritis.
But stand like this, it will really causes like joint problem.
Yeah, but a lot of people put up pain for beauty. So I don't think.
But it's not really an issue. Like.
No,
it's not really an issue.
Yeah.
Okay.
But I said it is, then Jimmy Choo will come in.
You destroy Jimmy Choo business.
Exactly. So I don't think there's any signs that show that shoes really affect it.
Okay. Alright, great. So, thank you, Doctor, for the answer. So for the next question from Hayati. So Doctor, what kind of activity is okay for people with osteoarthritis? Like just I think we have mentioned before.
So things that avoid loading the joint, such as if you got arthritis, you're not going to go to the gym and do squats and heavy lifting, right?
Yeah.
Because that's going to hurt you.
Yeah.
So things to avoid are like things that will cause your knee to put more stress on it. Yeah. So extensive running is not good.
Yeah.
Okay, but that's not to say running is not good.
Extensive is a key word, right?
If you run like 5K a day, suddenly you go to 30K in 1 week, that's not good,
Very
right?
good, yeah.
Because you're not built for that.
Yeah.
Yeah. So based on your own principle, see what you like, what's the base level, and then just add incrementally as you go along if you want to improve it.
Yes.
Yeah.
Slowly strengthen it.
Correct.
Yeah.
Correct.
Okay. Great.
Does that answer the question?
Yes, I
Yeah.
think yes. So it's, running is okay, just extensive running is not okay. So
Yeah.
make sure that you still go for exercise. Alright?
But similarly, if you're any stage arthritis, you can't even walk more than 20 meters. Then running is not going to be possible.
Yeah.
Right? So it depends on what level.
Maybe swimming would be a better because of water
Correct.
buoyancy.
Yeah, I would say swimming or stationary cycling,
Yeah.
a bit of yoga,
Okay.
that kind of thing.
Alright, great. So from hierarchy as well, alright? So any precaution that they should take before exercise if they have OA?
Caution that
I think they mentioned that I think just now doctor already answered. Said don't go for extensive. I think it's kind
Yeah,
of precaution.
correct.
Choose your exercise.
choose your exercise according to your lifestyle and your capability. Usually, I would say go and see a physio, someone professional to assess the program.
Okay.
Yeah, because sometimes exercising on your own can be quite boring.
Yeah.
And also it can be damaging because you don't know where to start.
Yeah.
When to stop. Yeah. So you might end up damaging yourself and doing more harm. So I would say go and see someone who at least professionally can advise you. And then you don't have to see them every day. You know, touch base with them again in a month or 2 or 3 months. And then gradually measure your improvement.
Maybe the physiotherapist will set the target and the exercise for them as well.
So the treatment is not like a race, it's a long marathon.
Yeah. Slowly, cannot rush.
Cannot rush.
Yeah.
Correct.
Alright. So I think you can go for exercise, but make sure that depends on your own capability and not go too extreme. Alright. So from another question from Shia. So doctor, if the pain prolonged, should I continue to do exercise?
I think the answer is
we keep mentioning that you need to exercise just
up to a certain
level.
Yeah, and then listen to your body. If the pain is something that's out of ordinary, and you don't feel very good, then that's a signal to stop. Right?
Yeah.
But if you do have, in a background pain, then after exercise you get a bit ache, it's quite normal.
Quite normal for the muscle ache.
That's all right. Yeah. Carry on. So just listen to your body.
Listen to your body. Body will give you a signal.
Correct.
When to stop.
Correct.
Yeah.
Yeah.
So
Correct.
another interesting question is a little bit out of our maybe out of our line actually, doctor.
Okay.
So is acupuncture really help?
Acupuncture. Oh, that
Maybe more
I
traditional Chinese
don't
medicine.
really, I don't think I'm ready to comment on that.
Yeah.
I'm not really trained.
It's not really our profession.
Yeah. So I know some patients present, post acupuncture and they find it helpful.
Somebody does.
But equally, I see people that doesn't work.
Doesn't work.
So
They don't feel anything.
I think no harm trying. It doesn't harm you. Carry on.
But look for a profession.
Correct.
Yeah.
Correct.
Alright. So so another question, once we're done with surgical, any chances that osteoarthritis may come again?
It depends what they mean by surgical. Is it something like that you have a permanent solution, like for example, joint replacement?
With joint replacement, they won't come back again.
Yeah. So once you've had the joint replacement, basically replacing the whole joint, then by definition, the arthritis is gone. There's no way that the arthritis will come back and affect the knee again.
How about the injection?
Whereas injection helps it temporarily, but because the knee is still present, right, those tissues are still there, there's still chance that they will come back.
Okay. Usually, how long?
So I would say the injection, in my experience, is about 3 to 6 months.
Okay.
Some injections can last for about a year. So that's the kind of average time span. Yeah. I mean, you can't expect the injection to last you for 20 years. Doesn't make sense.
But the period of time will still depends on person to person.
Correct. But let me reiterate. I mean, every time people ask me, so after the operation, can it come back? But the answer is very straightforward. If you replace the joint, then there's no chance for the arthritis to come back.
we change to a totally artificial
Correct.
joint,
Correct.
which cannot cause inflammation.
Correct.
Yeah.
Correct. It's like an analogy of a rotten tooth. You have a big rotten tooth, you get it replaced, you put a new crown, then in theory the problem shouldn't come back anymore. Yeah.
Because it is fake.
Yeah, correct.
It is not natural.
So it doesn't feel like a normal knee.
Yeah.
That's the only thing.
Okay.
It doesn't feel like your native knee again, but you should be able to sustain your day-to-day activity for the rest of your life.
Okay, so the last question I see here, maybe doctor can answer. So is it okay for osteoarthritis to do critical treatment? I'm not very sure what is the critical treatment about from what field?
I've not heard of crypto treatment. Yeah.
Cryptocurrency, yes. Which is quite scary.
Maybe what she meant was
Cryo, maybe, yeah.
Yeah, so cryotherapy treatment is another form of pain relief kind of treatment using, if I'm not mistaken, cold, right?
Yes.
Cold water.
Yes.
Yeah. So some people find it helpful. Yeah.
But just now the one you mentioned about
The same
ice pack.
principle is ice pack.
Yeah. So just for like a temporarily relief.
Correct. Yeah.
Okay, great. So OA, yes, if you mentioned about cryo treatment, which is to cool down your knee, yes, it does help for the osteoarthritis. It can reduce the pain sensation temporarily. But if you want to know exactly how to manage it, if let's say after cryo treatment is not helpful, maybe you see a Dr. Mark later. All right. So thank you so much for Dr. Mark sharing this this evening with us and with our audience. So thank you so much for everyone who joining us in this live show today, and hope everyone learned a little bit more about osteoarthritis, how to manage it, and how you identify whether you really have OA and need to look for help from Dr. Pharmacy. All right. So make sure that you answer the two questions just now, all right, and tag your friends and family, share this live show, and share and click like on the CARiNG Facebook page, all right. So we will be announcing the giveaway winner in our CARiNG Facebook page later on. So stay tuned to the announcement. And once again, thank you all of you joining us in this lovely evening, and hope everyone will stay healthy, stay safe. All right. Thank you, everyone, and good night.
Good night.